Watchdog says people who've had a stroke should be given a DNA test to find out which drugs could prevent further attacks.
The advice comes from NICE, the National Institute for Health and Care Excellence, which wants to reduce the risk of recurring strokes. Let's show you some figures now. Around 100,000 people have stroke every year in the UK, nearly half of which are recurrent strokes, which mean they occur in people who've already suffered at least one.
In fact, around 1 in 4 stroke victims will have another within 5 years, and close to half will have another within a decade. So those are some of the numbers. We're joined now by the GP, Helen Wall. Morning to you.
Hi, good morning.
I suppose in a way there's quite a fundamental question here. If there's a test that you can do that will mean that you as a doctor can give someone a drug that is more effective, why would you not do that?
Well, absolutely, and this is a draft guideline that's gone into consultation today, so that means people will be able to respond to it for a couple of weeks. I mean, there is a cost attached to this test, like there is with everything, but as we just heard, you know, nearly half of people who've had a stroke will have another one, and there is a chance that some of them will be having another one because they're not quite on the right medication, and it's important that we address that.
Just take us through the medication. So you can tell me the technical names for the drugs that are most commonly used for people who've had a stroke to try and prevent a further stroke. What is that?
So our first line, when somebody's had either a mini stroke, known as a TIA, or a full stroke, is clopidogrel. So we've got, I think, 11 million prescriptions of clopidogrel going out a year in the UK, which is massive. It's a very common drug. But we think that around about a third of those people may have a gene or a variant of a gene called CYP-C219, which means that they don't break down that drug properly and therefore able to utilise it properly. So if we've got 11 million of those prescriptions going out a year and we think almost a third of them are perhaps not getting the full effect that we need, then, you know, that's a massive cost as well, which might not be as effective as giving them the second-line treatment, which may work better for them.
How long have we known that a third of those people taking that drug may not actually be benefiting from it?
Well, it's a really good question, and I think when we say they're not benefiting from it, it's how much. So there will be some benefit from it, but how much benefit? And I think we've known for a long time about this gene that affects metabolism of certain drugs. That's how we break them down and utilise them, and it's not just clopidogrel, it affects other medications as well. But what we've not really known is how we get around that problem.
So is there an alternative for those that third, which hasn't yet been identified, although this test could? Is there an alternative possible? So, I know, for example, you're a GP, you have a patient who had a stroke, say, 4 years ago, a year after taking the drug, still kind of not, and still you know, showing tendencies. Is there an alternative drug you could have offered?
Yeah, there's always second-line, third-line drugs that we go to, so not everyone can take clopidogrel for whatever reason. There are always pros and cons to any medication. It's a blood-thinning drug in effect, an antiplatelet drug, so it thins the blood. Some people need a different one anyway, so this is not, you know, this is not going to cause us a problem in terms of being able to treat these people. It's just a more personalised care. But I think it's also important to note that we can't just rely on a medication to prevent strokes. We've got to look at the bigger picture.
Indeed.
Cholesterol, blood pressure,
But this is about
diabetes.
After someone's had one, isn't it?
Yeah, it's called secondary prevention, and secondary prevention includes making sure someone's blood pressure's controlled properly, their cholesterol's brought down, they're on a medication to thin the blood to prevent a further blood clotting effect or ischemic event, which is where the blood supply gets cut.
On a practical note, I mean, maybe in your GP surgery today, someone watching this has got a friend or a family member who's had strokes or a stroke or strokes before. They might be thinking, well, I'll go to my GP and I'll say, why can't I have a genetic test to make sure I'm on the right medication? I mean, can they? What's happening? Because this is in the trial phase.
I think it's really important to get the message that this is a draft guideline that's come in today for consultation. It's not happening yet. This test is not available for GPs to order yet, or even hospital specialists, as far as I'm aware. So there's going to be a bit of time of scoping this out and bringing this into practice. So not quite time yet to ring your GP and ask about this.
So, in practical terms, because we often talk about the pressure that is facing GPs and time, in practical terms, how much would this improve kind of time management and, you know, what GPs, the pressure GPs are under?
Well, I'm not wholly sure that it would affect time management for GPs particularly, because we would be instigating or continuing drugs for this regardless. If it's not clopidogrel, it'll be a different medication. We're not going to stop treating these individuals. It'll be different. But what it will stop is the recurrent, or not stop, but reduce, hopefully, the recurrent number of strokes. And 43,000 people a year having a recurrent stroke, 46,000 people a year having a mini stroke, which is often an indicator that a bigger stroke's going to come. So we put them on this medication. Is huge. And if we can reduce that even slightly, we're going to reap benefits in the NHS.
You didn't come here to talk about the Gladiators, Helen, but they were quite active. Do you remember them?
Oh, absolutely.
Which was
every
your
Saturday
favourite?
night. It's got to be Jet, hasn't it?
There we go. Everybody's got a little memory, haven't they?
Yeah, every Saturday night without fail. Loved it.
It's coming
Thank
back.
you.
Thank you.
It's coming back. We're revealing 2 new Gladiators on the programme later. So maybe like Helen, you spent your Saturday evenings watching Gladiators. Look at it. In under an hour, we'll be revealing 2 of the new ones. We'll be taking on the mantle. The classic show is being rebooted, and the 2 of the new Gladiators are going to be joining us on the sofa at 10 to 8. I don't think the ones we've got are going to be the grumpy ones.
Well, I don't know that. Who knows? We'll find out, won't we? Time now to get the news, travel and the weather. Where you are.